Hello, I'm Tim Nilsson. I'm 68 years old. I live in Northern California, and today is January 11th, 2025. 8 weeks ago, I had fusion surgery on three of my cervical vertebrae, numbers 4, 5, and 6, plus 2 discs that had to be replaced. I was vacationing in Nuevo Vallarta on November 14th, 2024. It was about 4:30 p.m. in the afternoon. I was body surfing and a wave turned me upside down and just pushed my head right into the sand and broke my neck. My arms and legs were paralyzed, and I was helped to the shore by my wife and a young woman. And I was taken by ambulance to Hoya Rivera emergency room. It was a very short ride because it's very nearby the resort. And immediately the ER doctor had a CT and an X-ray taken. And then Dr. Ricardo Martínez Perez, a spine specialist, arrived on the scene and ordered an MRI. I had to get the MRI from a sister hospital about 20 minutes away by ambulance. That's Hoya Marina. And we had the MRI done and then came back to Hoya Rivera, and I was admitted to a hospital room about 11:30 at night. The next day, November 15th, that was Friday, during the morning, Dr. Ricardo spent 1 hour with us going over the MRI results with my wife and me. And as I said, I had 2 of my cervical discs were herniated, and I had a contusion on my spinal cord. My hands and forearms felt like they were on fire, and pins and needles, very painful. The doctor said that immediate surgery to avoid permanent damage needed to be done. Of course, my wife and I were very concerned about having surgery in a foreign country with a doctor that we did not know. And the doctor said, Dr. Ricardo said that we would have to stay for an extra 2 weeks after the surgery before I could be released to go home. So the next 24 hours, we were researching our options. However, the number of positives far outweighed the number of negatives for having surgery in Mexico. Dr. Ricardo is known to be the best spine specialist in the region, and he's performed 60 of these procedures before me. He said he could operate the next day, and that was important because with a spinal cord in crisis, hours matter. Our travel insurance would cover surgery, lodging, but what they would not cover was an air ambulance back to the United States, which would have cost us $45,000 out of pocket. Also, my spine doctor here in the United States could not advise us or give us a surgery date because we were outside of the United States, which was very disappointing to us. So everything indicated that we should go ahead and have the surgery in Mexico. The next day was Sunday, November 17th, and I had surgery at about 8 o'clock in the morning there at Hoya Marina. There were 4 doctors at least involved with the surgery. Dr. Ricardo, the anesthesiologist, and also 2 neurological specialists who were monitoring my nerve conductance during the surgery. So there were 4 doctors involved. I couldn't believe that they could pull that together in less than 24 hours, but they did. The equipment and the facility, I would say, is state of the art, and the quality of care that I received at the hospital there was equal to or better than any that I have had in the United States. And their compassion and empathy was greater than I have received with most of the doctors that I have seen in the United States. 2 days past surgery, I was released to a nearby resort hotel. I had physical therapy that came almost every day. They would have come every day I said some days I just needed a day off. But other than that, they came and worked with me for the 2 weeks that I was there. So 2 weeks post-surgery, Dr. Ricardo removed my stitches. He released me to fly home commercially and ordered me to follow up with a neurological surgeon, which I am supposed to do tomorrow. It's taken me that long to get in to see a neurological surgeon here in the United States. 2 days after I was released to fly home, we traveled by commercial flight from Puerto Vallarta. The travel insurance company booked us with first class seats, which was very nice. However, the flight, our first leg went to Seattle. Our connecting flight to Medford, Oregon was canceled, so we had to spend the night in Seattle. And by the time we drove home the next day, after flying to Medford, I felt like I had used every ounce of energy that I had to get home. And the point I'm making is that I could not have flown home commercially before the surgery. I would not have had the strength to do that. That was one of the things that we considered, and it would not have been an option. So as I said, today I'm 8 weeks post-surgery, and I still believe that we made the right choice by having the surgery done there in Mexico. Dr. Ricardo Martínez Perez is an exceptional spine surgeon. He's a wonderful human being.